Okay, we're going to wrap up our lesson on the pharmacology update related to COVID. We're going to wrap up by revisiting our patient case. So we have Mrs. J, 64-year-old woman, admitted to the hospital with fever and shortness of breath. She had COVID. She was intubated and mechanically ventilated and was eventually extubated. She does have several features of her past medical history put her at higher risk of developing or being hospitalized with COVID, and also higher risk of death with COVID. So certainly coronary artery disease, hypertension, and diabetes were on those list of comorbidities. She has a list of current medications, and what our job is to understand the impact of her medications on her rehab. So two of the first medications are metoprolol and lisinopril. So remember, metoprolol is a selective beta blocker. Lisinopril is an ACE inhibitor. Those are both primarily prescribed for her hypertension. So when we see those drugs, the things that we want to do is definitely monitor blood pressure. We want to monitor to make sure, number one, that her resting blood pressure is controlled, and number two, that she's not having episodes of orthostatic hypotension. And remember that metoprolol, the beta blocker, is going to change the relationship between exercise intensity and heart rate. It's going to blunt that increase in heart rate. So rather than using heart rate as a way to monitor exercise intensity, generally we're going to use rating of perceived exertion. So either a 6 to 20 scale or a 0 to 10 scale. That's going to be a better way to monitor exercise intensity. We should also keep in mind that beta blockers can decrease maximal exercise capacity. She still should be able to do some submaximal work, but it will decrease maximal exercise capacity. Another medication that she's on is clopidogrel. This is an antiplatelet activator, so this is going to decrease the risk of clot formation. One of the side effects is increased risk of bruising or bleeding, so that is something that we're going to watch for. And atorvastatin, which is obviously a statin. This is to manage her cholesterol levels. The main thing that we should be paying attention to with statins is myalgia. So we want to ask about muscle pain. We want to monitor muscle for progressive weakness. And if we are using resistance exercise, we want to make sure we do a warm-up, and we want to be careful with our progression of resistance exercise in order to avoid excessive muscle damage. So we might be avoiding high intensity and eccentric exercise, particularly in the earlier phases of our exercise, because of that risk of myalgia and muscle damage. She has a number of other medications. So Metformin, we mentioned this as an insulin sensitizer. She's using this to help manage her diabetes. We talked about this as a cornerstone of diabetes management. When we see this drug, we want to ask about if the people are monitoring their blood sugar, ask about how tightly their blood sugar is controlled. A risk of metformin use is lactic acidosis. So particularly during exercise, we want to monitor her response to exercise and look for any changes in cognition that might suggest a poor response to exercise. She also takes two respiratory medications. They're both inhaled. Spiriva is a long-acting bronchodilator, and albuterol is a short-acting or rescue bronchodilator. Spiriva, the main thing we look out for is tachycardia. With albuterol, restlessness, tremor, and cardiac irregularities are all things that we want to watch for. The other thing that we want to watch for is to make sure that she's using her inhaler properly, because if she's not using the inhaler properly, obviously the medication is not being delivered to the areas of the lung that it needs to be. Now, as a last slide, I just wanted to mention briefly an issue that we haven't really talked about up to this point, and that is the coagulopathy that is associated with COVID. So this was recognized probably in mid to early April, that COVID was associated with an increased risk of venous, arterial, and microvascular occlusion. In the inpatient side, low molecular weight heparin is one of the primary things that are used. On the outpatient side, most likely there's going to be oral anticoagulants. Betrixaban and Xarelto are the two that are that you're probably most likely to see. Those are going to increase the risk of bleeding, particularly if they're taken along with the antiplatelet inhibitor that we talked about before. So those are some other drugs that you might come across. We mentioned that there's not really a standard treatment for the COVID condition itself, and there's not really a standard treatment for the acute respiratory syndrome that is distress syndrome that is associated with COVID. So there aren't necessarily specific medications that you would come across related to those, but you most likely will come across some of the medications that we've talked about. Thank you very much for listening, and I hope this was a useful lesson for you.